Hi, I'm Lee McGuire, and we're here at Advanced Surgical Arts with Dr. Doohi Lee, and we're going to discuss a few options for you that are a little bit different than what you've been hearing. So it's kind of exciting. Can you share this with us?
Obviously, we're going through some very difficult times, through coronavirus.
Stressful times,
very
yes.
stressful times around the whole world, So there have been some really interesting new developments in the news from the medical community. And I think this has been around for quite a while. And what I'd like to do is maybe encapsulate and summarize very briefly for some people to have some understanding that, all is not lost and there is hope out there. So there's a medication that is called hydroxychloroquine. It's actually a derivative of chloroquine, which is an anti-malarial medicine. If you have malaria, you give this to fight malaria. It's being used around the world. It's been around for many, many years, and very inexpensive. And what's interesting about this medication, it actually has an antiviral effect on a type of virus. So this COVID-19 or coronavirus falls in the category of what they call an RNA virus, and this medication actually has an effect against that. And there have been some studies coming out, and most recently there was a study out of France. The doctors treated many patients. I think it was over 40 patients were treated with this medication, and they claimed they had 100%, I don't know what to say cure, but 100% effectiveness against coronavirus in this patient.
They 100% felt better, is what you're saying.
Felt better and got recovered,
right,
which means basically
right.
eradicating the illness.
Do you have to take it way before you get the virus? Should you already be taking it, or do you take it when you feel like you've got symptoms of the virus?
Well, there's a couple of things, okay? So I did some more thorough investigation into this, and so it actually works at the point of entry, let's say, almost as a prophylaxis. Prophylaxis means preventing a bad outcome before it happens. So if you put somebody on medication prophylactically, it means you're actually kind of anticipating certain events to happen. And so the medication can kind of forestall or stop that, okay? So that's what prophylaxis is. So you can use it in that sense as well. Also, you can use it if somebody actually contracts the disease. You can put them on this medication. It can help them in terms of recovery.
So you recover faster. You still have the symptoms. Mm-hmm. You still go through some of it, but it's not as bad.
Exactly.
Is that correct?
So there's a range of what can happen. No medication or anything we do is 100% good for everybody, right? So depending on your own health status or how you assimilate this medication and how strongly this virus is attacking you, you will have different degree of effectiveness. But the overall message is you have a medication that's been around for decades that actually has efficacy against this virus. So that really is the message of hope. I think that's something we can all take.
Are there any side effects? I know people get really concerned if they begin taking something before they get the virus, or if at all. Yeah. But is there any type of side effect that anybody should be concerned about? Yeah,
primary side effect is with the liver. You can actually have some effect on the liver, but in a normal small dosage, I think the side effect for that is very minimal. But for people who really have medical issues and they're taking multiple medications, they need to discuss it with their doctors who are prescribing other medications to them. If the data progresses forward, that it really is known to be a valid, data, then this has really been this will be a godsend in my opinion. Obviously, there'll be other things coming up down the road, including vaccines, against the coronavirus and maybe other potent antiviral medications that we're not aware of at this point. But right now, if this medication, which is really abundant and very inexpensive, if it can have this kind of a profound effect on somebody with COVID-19 infection, this will be truly a very, very important development and certainly a game changer in a lot of people's lives. And that really is sort of the message of hope that I want to
And we need that right now.
Oh, definitely.
Right?
Are you kidding? Oh my God.
Well, I'm Lee McGuire here at Advanced Surgical Arts. And if you're interested in this with Dr. Doohi Lee, please give Advanced Surgical Arts a call and they'd be happy to help you.